Hartford Healthcare is so pleased to announce that Midstate Medical Center's breast center is now open, and it offers some tremendous services for people in that area. Women not just who are dealing with breast cancer, but also who want to know their risk for breast cancer. And to talk more about that now, I'm so happy to have Dr. Camelia Lawrence here. A pleasure to meet you, Doctor. Glad to have you on the show.
It's a pleasure to be here. Thank you for having me.
And this is exciting news. Please tell me all about the center.
It is. So Hartford Healthcare at Midstate Medical Center recently opened our state-of-the-art comprehensive breast center. It's really a treasure within the community because the center houses all the components needed for the management of the breast patient.
And what are some of those components? Please list them.
Well, all the specialists are there, including medical oncology, radiation oncology, as well as pathology, and fellowship-trained breast surgeons are there as well. Our latest addition is Dr. Nia Wilson, and Dr. Elizabeth Meriden is also there. But what's enticing about this center is that a woman can come in and have her mammogram done, and if an abnormality is identified, they can have their biopsy the same day, as well as a consultation with the breast surgeon. Yeah, it's the same day.
Yeah, I'm starting to see this trend now with more and more, whether it's men's health, whether it's breast health, of this comprehensive center. How much easier does that make it, not just for patients, but also for doctors, for healthcare providers, to be able to streamline the process like that?
Well, you're sort of at the forefront. You're at the beginning of the journey with the woman that may have a newly found breast cancer. So they can come in, they get a baseline exam, the biopsy is done, and in most cases, working very closely with the pathology department, we get those results back in about 24 to 48 hours.
Wow.
So it's a game changer, and that's what really sets us apart as an institution.
And is it just having that concentration of medical experts also together? Does that make the group better? Does that make each individual one of them more effective?
The dynamics is much better because all the experts gather once a week and they discuss all the cases. Because what we do know is not all breast cancers are the same, and we're really personalized in breast cancer care at the Midstate Medical Center.
Part of that is genetic testing, I imagine.
It's so important for a woman to understand what her risk is for breast cancer. I mean, imagine there were 8 of us women sitting on this couch, and one of us would be impacted by breast cancer.
Yeah.
So the genetics program that's available at Midstate Medical Center is really funneled through our radiology department. A woman comes in, there's a questionnaire that's completed that helps to determine her risk for breast cancer. And if she does meet criteria, she's able to undergo genetic counseling as well as testing.
The genetic counseling, that alone is just such a burgeoning industry. Because talk to me about the importance of being able to not just give women the raw data that the genetic testing provides, but the proper context in which to put it.
Exactly, because it's important to know how do you utilize that information. What we do know is the overwhelming majority of breast cancer, we don't exactly know what caused it. And in Connecticut in particular, we have the second highest incidence of breast cancer cases nationwide. But by having that information, it's empowering that woman. In some cases, it requires increased surveillance, maybe mammography, ultrasound, as well as breast MRI. And in other cases, such as the BRCA1 and 2 mutation, we know those women, it's not a matter of whether they get breast cancer, is when. So there's risk-reducing surgeries that can be done as well.
Yeah, so it's not just mastectomies to get rid of tumors, there's preventative mastectomies now. That comes with scarring sometimes. What can be done about that at the center?
Well, many of us, the breast surgeons in general in the Hartford healthcare system, we all perform what's called a hidden scar surgery. And what that means is placing the incision for a lumpectomy or a mastectomy in a location which cannot be readily seen. It's not visible. While some women may consider their scar from the breast surgery as empowering from their journey, there are others who would prefer to have the scar hidden. So it's placed in locations where you would be unable to tell that this woman has actually had breast cancer surgery.
And for women who are looking for that option, what does that do for themselves, for their body image?
Well, we know that it has impact from a psychological as well as an emotional standpoint. I have patients who come in and they say, thank you after, because when I wake up in the morning, I look in the mirror, I don't see my scar, and that's important to me.
And I like how you're telling me this, highlighting not just the individual nature of the cancer and of the treatment, but also of the psychology behind it, that some of them look at it as empowering, but some of them don't, and that you're able to accommodate that either way. That's wonderful.
Yes. I mean, the center is created taking the patient at the heart of everything that we do there. It's really designed to facilitate the best possible outcomes.
And it's open right now. Again, Midstate Medical Center's Breast Center. Dr. Lawrence, thank you so much for joining us today.
Thank you for having me.
It's wonderful information and a pleasure to meet you.
You too.